Hello, my name is Kayla and I'm one of the registered dietitian nutritionists at San Antonio Regional Hospital. Cancer treatment often leads to oral complications such as nausea, mouth sores, changes in saliva, and changes in taste and smell. In this video, we will discuss tips to manage each of these complications to help you have a better quality of life. We will also touch on the option of nutrition support or tube feeding. Oral health is important for keeping the mouth clean to prevent infection. To avoid irritation in your mouth, choose softer foods such as scrambled eggs, mashed potatoes, pasta, oatmeal, pudding, etc. These foods may be easier to chew, reduce the amount of time that food stays in your mouth, and overall be more gentle if your mouth is sore. High-protein foods such as meats, poultry, and fish, and sauces and gravies may help to speed healing. Avoid commercial mouthwash, alcohol, acidic foods and drinks, caffeine, carbonated beverages, and tobacco, as these items may further irritate the mouth. Gentle oral hygiene can help prevent or reduce mouth sores, gum disease, and tooth decay. Keep a clean mouth by brushing with a very soft bristled toothbrush. Replace your toothbrush often, and ask your doctor if it is okay to continue flossing. Using an oral rinse can help keep the mouth clean and help reduce soreness. Above, I have listed the recipe for a homemade mouth rinse from the American Cancer Society. If you find that this recipe is painful, you can decrease the salt and baking soda to as little as 1/4 teaspoon each in 1 quart or 4 cups of water. This mix is to be used as a mouthwash. You can also gargle it to soothe a sore throat, but try not to swallow it. You may use this rinse every 2 hours or as needed. To summarize, radiation and certain chemotherapy drugs may cause mouth sores. To avoid further irritating your mouth and throat, avoid tart, acidic, salty, or rough textured foods. Avoid alcohol, tobacco, and caffeine. Note that strong spices that could cause a burning sensation in the mouth, such as chili powder, cloves, curry, hot sauces, nutmeg, pepper, and horseradish. Some additional tips for continuing to eat when you have mouth or throat sores include choosing colder foods, soft and creamy foods, and pureed foods. Try using a straw or tilting your head back to avoid mouth sores and facilitate swallowing. Lastly, you can try a mouth rinse like the one on the previous slide to soothe sores, or ask your doctor about a numbing agent to use before eating. Radiation and some types of chemotherapy may lead to dry mouth or thickened saliva due to damage to the salivary glands, which could decrease the amount of saliva that your body produces. This condition is called xerostomia. Dry mouth can be uncomfortable. To keep your mouth moist, be sure to drink a lot of fluids. This also helps to thin the mucus. Sucking on ice cubes, sugar-free candies, or gum may help to stimulate saliva production. For the American Cancer Society, citrus, cinnamon, and mint flavors tend to work well for this. When eating, take small bites and chew food well to ensure that each bite of food, or bolus, is well moistened to swallow easier. If you don't have mouth sores, fresh pineapple or papaya have enzymes that may help to thin saliva. Another idea is to moisten foods with gravy, sauce, juice, water, or milk to help facilitate swallowing. If you are experiencing dry mouth, it is especially important to maintain good oral hygiene to prevent mouth sores, gum disease, and tooth decay. Consider also using lip balm to prevent drying or cracking of your lips. Lastly, saliva substitutes may be helpful for those who have had their salivary glands removed or damaged by radiation. Changes in taste and smell can affect your appetite or desire to eat. If foods are tasting metallic, you can try avoiding metallic utensils and instead use plastic or bamboo utensils, or try eating fresh or frozen fruits and vegetables instead of canned foods. If foods are tasting bitter, you can try adding sweetener to counteract the bitterness. On the other hand, if foods are tasting sweet, you can try seasoning or pairing foods with a tart flavor, such as a squeeze of citrus, vinegar, or pickled foods. Tart flavors tend to be well tolerated in those who do not have mouth sores. If red meats are tasting different to you, try other protein sources such as eggs, cheese, poultry, fish, nuts, or tofu. Marinate meat to increase tenderness. Avoid your favorite foods if you have taste changes. This might create a negative connotation if your once favorite foods are tasting funny, which may discourage you from eating your favorite foods at a later date when you're feeling better. If you are noticing a change in smell, you can try opening windows, cooking in a well-ventilated room, turning on a fan at mealtime, or eating outside. Often, waiting to eat foods when they have cooled down will help reduce the steam that carries the scent and make it more tolerable. Try covering beverages in soups and drink through a straw, or choose foods that do not need to be cooked. Blend fruits and vegetables into smoothies, ice cream, or yogurt, or try frozen fruit as a cold treat. Lastly, keeping your mouth clean or utilizing the baking soda and salt mouth rinse before meals may help create a neutral palate and help foods taste better. Be creative and find what works for you. Try new foods and flavors. You may find that you like something that you did not like before due to changes in taste or smell. Cancer treatment can lead to nausea with or without vomiting. When someone is having nausea, it may be easier to aim for having several small snacks or mini meals throughout the day instead of having 3 larger meals. Having smaller portions may be easier to tolerate. Start with room temperature or colder foods and bland foods, which tend to have less odors. Lower fat and lower fiber foods will digest faster and may be better tolerated. Avoid fried foods and other high-fat foods. High-fiber foods, foods with strong odors, and foods that typically cause gas. After vomiting, rinse your mouth or suck on hard candy to reduce the bad taste in your mouth. There is evidence that ginger can help calm an upset stomach and reduce nausea. Some patients have found that tummy drops or ginger candy, as shown on the slide, have been helpful. About 30 minutes after vomiting, try sipping on clear liquids such as broths, gelatin, sports drinks, juice, popsicles, and ice chips to rehydrate. If you are able to keep liquids down and when you are ready to try solid foods, be sure to eat sitting up to facilitate the digestion process. Start with small portions of bland, solid foods such as applesauce, dry cereal, crackers, dry toast, and bananas. Start slow and gradually advance your diet, aiming to eat 6 to 8 small snacks per day. Some find that keeping a food journal of foods they tolerate or do not tolerate helps them select more tolerated foods when they are not feeling well. If you are experiencing nausea or vomiting, talk with your cancer care team. There are medications that can help manage your symptoms. If you are having a lot of difficulty swallowing, your doctor may refer you to a speech therapist to help teach you swallowing techniques. However, when a person is having some of the difficulties mentioned so far in this presentation, it can be very difficult to eat and drink enough to maintain optimal nutrition status. There is something called tube feeding, which means that you are avoiding the mouth and esophagus by placing a tube directly into the stomach or small intestine. Opting for a feeding tube does not equal failure. Tube feeding can be a shortcut to getting the nutrition, fluids, and medication your body needs. Tube feeding may also reduce the need for IV hydration infusions and decrease the number of pills you need to take since medications can be administered via the feeding tube. Tube feeding can be temporary. Some people are even still able to eat orally with a feeding tube in place. It depends on the individual. Many people who opt for tube feeding say that they wish that they had done so sooner, as they feel better overall and are less burdened by not having to force themselves to eat.